Good morning, everybody, and welcome to the ACCEND webinar and the launch of the ACCEND Cancer Hub. I'm sure all of you are very familiar with the live events. What I'd like to just remind you is that there's a Q&A function that you need to actually use to ask your questions. So to introduce myself, I'm Professor Geeta Menon. I'm an ophthalmic surgeon by background, postgraduate dean for South London, lead dean for the Cancer and Diagnostics program, and the SRO for the ACCEND program. If I could have the next slide, please. So I'd like to welcome you to the Aspirant Cancer Career and Education Development ACCEND program. So why do we need a program like this? As we all know, cancer is a complex disease and it will affect at least 1 in 2 of us. So in order to meet the ever-increasing needs of people living with cancer now and in the future, we need to really invest in our cancer workforce. So this program has been established to provide that end-to-end transformational reform in education training as well as in career pathways, not just to support pre-registration and registration nurse associates, nurses, allied healthcare professionals, but also the support workforce as well. And these are all professionals that are actually supporting people affected by cancer, both now and in the future. The program is funded by the Workforce Training and Education Directorate in NHS England, which was formerly known as Health Education England, in collaboration with several stakeholders, as you can see on the slide. The overall purpose of the ACCEND program is to actually provide that clear, transparent guidance and direction on knowledge, skills, and capabilities required by all the support workers, nursing associates, registered nurses, and allied healthcare professionals who actually care for people affected by cancer, both in the generalist as well as in the specialist cancer services, and roles as a part of the multi-professional teams across the 4 nations. We strongly believe that to retain our workforce, we need to have that career progression, and this program hopefully tries to achieve all of that. I hope you have a really good webinar today, and I'm hoping that you will all actually use the Q&A function to ask your questions. I'm going to now hand over to Vanessa Taylor.
Thanks, Geeta. I'm just checking that my mic isn't muted. Hi, everybody. My name is Vanessa Taylor. I'm Professor of Cancer and Palliative Care at the University of Huddersfield. In this context, I'm a member of the ACCEND programme steering group and also chair of the Workstream, which developed the career pathway, core capabilities in practice and the education framework. The ACCEND programme itself, which Geeta's outlined the purpose of, responded to a number of reports over many years from both NHS and charitable organisations. And these have identified the lack of a nationally agreed competency and skills framework for the cancer workforce, nursing and allied health professionals, the absence of a defined route for nurses and the allied health professionals to have a career in cancer, and the absence of a competency and skills framework for clinical nurse specialists. And overall, the need for a stronger focus on succession planning for the specialist cancer nurses and the allied health professionals in those services. And today, these issues that have been reported on over many years remain, and we require that urgent action. And the ACCEND programme is seeking to provide that clear and structured career pathway for the nursing and allied health professional workforce, who, as Geeta said, provide care to people affected by cancer in both general and specialist cancer services and roles. Next, please. Next slide, please. Thank you. So the framework was published in January of this year. It draws together a wealth of work that's been undertaken by individual services, organisations, professions across the UK, and brought together different organisations, expertise of both professionals and service users. And some of you may have been involved in providing feedback during our consultation period last September, and we thank you for that feedback. All of that work has gone into creating the framework that, as I said, was published in January of this year. And the framework sets out that standard and offers a pathway for the development for the workforce who provide that care to people affected by cancer across a range of services and settings. So our aim is, hopefully, regardless of background and level of practice, the workforce will have the support that it needs to provide high quality personalised care and to plan and develop their career in cancer care. Next slide, please. The framework includes 3 components: the career pathway, the core cancer capabilities in practice, and the education framework, and these fit together like pieces of a jigsaw. The first component, the career pathway, identifies 7 career levels for the workforce who provide cancer care. It gives insight into the knowledge and characteristics required for each level to work at each level of practice, from the supportive through to the assistive, pre-registration, registration, enhanced, advanced, and consultant level practice. And practitioners can see the ways in which they can progress along that career pathway. We purposefully didn't use role titles, job titles, or pay banding, because we're aware of the variation that is present across different services and settings. So we talk about levels of practice. The second component is the core cancer capabilities in practice. And these describe the core capabilities for each level of practice necessary for safe and effective care. This provides that supportive structure for practitioners to develop and evidence their knowledge, skills and behaviours. And we use colour coding for each level of practice so that there is flexibility there. These may be helpful for developing role descriptors, for evidencing a practitioner's own practice capabilities and identifying those workplace development needs. And practitioners may find that they have capabilities from different levels of practice to meet their role requirements when you use the framework in practice. The final part, or the third component, is the education framework. And this sets out the minimum standard for knowledge and understanding about cancer and care of people affected by cancer for each level of practice. In the framework, there are learning outcomes and indicative content provided for core knowledge and understanding, and these also underpin the relevant capabilities. Although the learning outcomes and the indicative content are presented in module format called Foundations and Fundamentals in Cancer Care for the different levels of practice, we don't necessarily mean that this only relates to accredited learning. Practitioners can achieve and evidence the learning outcomes and the capabilities through workplace-based learning and e-learning opportunities. The depth of knowledge and understanding that's required by nursing and allied health professions following registration to consultant level roles in specialist services can be developed from the core knowledge identified in the fundamentals in cancer care, and can be achieved through post-registration continuing professional development, postgraduate awards, and also aligned to national requirements and frameworks in advanced and consultant level practice. And we talk about working with the various frameworks for advanced practice and different organisations such as the Centre for Advancing Practice to ensure the framework aligns to that work. The framework also includes learning outcomes for postgraduate certificate as a qualification in specialty, which we'll talk a little bit more about later on as in our future work. The learning outcomes are identified also for pre-registration learners undertaking nursing and allied health professional programmes, and these are to be achieved at the point of registration. And we've created some e-learning resources which Julie is going to talk about later on in the webinar to support pre-registration programme teams with these. Next slide, please. The key part for us now is to work on supporting organised services and practitioners with the implementation of the framework, and to help organisations and services share ideas and to support that. The three components of the framework are there to help services, educators, individual practitioners and professionals. And it can help commissioners, for example, to set out clear expectations of the knowledge and capabilities of the workforce. It can be there to be used by employers and service managers to use the framework and inform workforce development, and also to show the workforce that they employ how they meet the core knowledge, understanding and capabilities in practice, and put development plans in place as well. And it can also be used to support appraisal and continuing professional development. For those educators who may be listening to the webinar today and training providers, the implementation guides for the framework include audit tools to enable educators to review and inform their curricula, and clinical supervisors at all levels can use it to structure assessment in practice. As I mentioned, there are various implementation guides that are available on the website, the ACCEND web page, and we're keen to support implementation and looking to create a community of practice to support sharing of all examples and challenges and successes for implementation of the framework. And on the slide here you can see some links to some of the resources available. So moving forward, next slide please, into future work and how we're planning to support implementation of the framework. You can see here some of the activities that are planned for the next year and up to 2025, including increasing programme resources, including some clinical fellows, which will again support the implementation of the framework, working with services and organisations. We're looking to open up an innovation and training and education fund, which will offer opportunities for funding for employing organisations to come up with ideas to implement the framework and to receive some funding to undertake that and to evaluate it and share how we might upscale and extend the implementation plans undertaken within various organisations. Today we'll also be talking about the launch of the ACCEND Hub, and John will be giving you some information about the supportive and the assistive workforce, and Julie will be talking about pre-registration learners and the resources which have been created for those parts of the workforce. We'll be looking to procure a qualification in specialty around the postgraduate certificate and the learning outcomes mentioned in the framework, and also professional development and clinical leadership module for those progressing to enhanced and then onward to advanced practice roles. We're starting to look at the workforce and collect some baseline data to understand training needs, both nationally and regionally around the cancer workforce. and also going to be creating some pre-registration curriculum guidance and recommendations for HEIs and education providers, working collaboratively with the Council of Deans for Health. And also for pre-registration learners looking to introduce a student fellowship programme. For those in registration level, looking towards moving towards enhanced and advanced practice, and then on to consultant level practice, we're seeking to develop resources around the range of learning opportunities for those registered practitioners who are looking to develop their knowledge, skills and understanding. And there'll be information about the range of education and training opportunities on the ACCEND hub, and also working to develop a consultant pathway for those aspiring consultant level practitioners in the cancer workforce. So we've got a wealth of activities coming in the next year as we look to encourage, support and enable the implementation of the framework. And I'm going to hand over to Libby now to talk about the ACCEND hub. Thank you.
Thank you very much, Vanessa, and delighted to be here, and very much delighted to tell you about the launch of our ACCEND Cancer Learning Hub today. So my name is Libby Potter, and in this context I'm the co-lead for the ACCEND programme, but I work for NHS England as a head of portfolio role, heading up some clinical education and training programmes here in Workforce Training and Education Directorate. So as I say, I'm delighted to be able to talk today about the official launch of our ACCEND Cancer Learning Hub. So the hub, as Vanessa has said, is to provide a one-stop shop or a go-to place, we hope, for the cancer workforce or anyone working in a healthcare role that supports people living with and beyond cancer at any level of practice and in any setting. So on the ACCEND hub, you should be able to find, and the key aim is to find information centred around capability building and the building of skills and knowledge through supporting you in education and training, and also information and advice on career pathways. Next slide, please. So we know it's a bit of an enormous task to create a go-to place, a one-stop shop for the entire cancer workforce and for those supporting people living with beyond cancer. So we're doing this in phases, and we're doing this in quite an agile way. So we hope to very much be an agile process and gain feedback and evaluations and continue to improve what we've launched today. But as Vanessa said, build on what we've launched today in terms of the pre-registration areas and also the supportive and assistive toolkit that we've built today, and then further build on the registered, enhanced, advanced towards consultant hub areas that we'll be building this summer. I'd really like to just take the opportunity to say thank you, because there may be some people here who have worked in the work streams to build the content and the resources for the supportive and the assistive toolkit, and also the students areas that we've built that Julie and John will share with you today. We couldn't do it without you. We absolutely need subject matter experts. It needs to be driven by the system, and we need to do this in collaboration with all the stakeholders who provide their time and expertise for this to happen. Next slide, please. So finally, how to access the hub. So you can do this three ways. You can enter it via the eLearning for Health home care page. So that's does require a login and a registration. At the moment, the ACCEND hub will be open as a blue access, which really means anyone with an NHS email or with an ac.uk. But when you register, if you're working in an area such as local authorities or in hospices or in care home settings and many other places, this site will be open to you. It's also available via the ACCEND eLearning for Health programme page. You should be able to find a link on that programme page if you scroll down the page. And then also just directly through the NHS Learning Hub. We hope, as I say, to open this up to what we call green access, which is to anyone. out there with an interest in learning more about cancer, but this probably won't be available until after the end of the summer, towards the autumn, but we'll obviously let you all know about that. So I'm going to hand over now to John Gale, who's going to talk you through the supportive and assistive toolkit that's been built. Thank you.
Thank you, Libby. And just a quick introduction. My name is John Gale. I'm from the Cheshire and Merseyside Cancer Alliance, and I'm the supportive and assistive workstream lead. So I'm supporting the ACCEND programme to develop the ACCEND Learning Hub. So how has the ACCEND Learning Hub been developed? Well, it's been developed and designed utilising the framework which Vanessa spoke about earlier, thinking about the capabilities in practice, a career framework for the cancer professional at all levels of practice. And I'm just so excited to talk about this today and the launch of the hub. And again, I'd just like to reiterate what Libby touched on there, and thank you to everybody involved from the supportive and assistive levels of practice and the pre-registration level of practice with Julie and the team there focusing on the foundations of cancer care. It's been a massive undertaking of work, and just a massive thank you to you all. So just in regards to stakeholder engagement, it is key to developing this area of work, and also working with a variety of different partners, such as Laura Pope and Tracy working in the Learning Hub team, and also a special thanks to Lucy Conway, who's worked in the Cheshire and Merseyside Cancer Alliance with me, doing all the background on getting the spreadsheets and the information all aligned so we can develop something like this, and also all the people on both of the work streams. So what has worked well? How have we got to this point today? Well, for the supportive and assistive and the pre-registration, we've actually spoke to the workforce. So at each stage of this development, we've been gaining feedback so we can develop this hub. And what has been said to us is we need something that's user friendly, easy to use and easy to navigate. So please note, this is just the start. We've been really focused on producing this as a free learning hub toolkit for the supportive and assistive and the pre-registration work streams, but there is much more to come. We value your feedback, and it will be developed and added upon over the next 12 months. So please ask any questions in the chat box, and we will also answer them. And also there's opportunities to get involved in this area of work moving forward. As I said, there's more to come. So we will be looking at the registered, enhanced, advanced and consultant levels of practice, and developing an ACCEND Learning Hub for each one of these levels. So just so you can have a little look at the Learning Hub itself, we've developed a short video for you to watch.
With the framework being launched in January 2023, we're now ready for the ACCEND Hub. Training and education in a variety of different ways supporting the workforce. From e-learning resources, face-to-face virtual training, and how can you support others by signposting them to other useful resources from our colleagues in Macmillan and others. So when you log into the ACCEND Hub, you'll be able to register on the foundations of cancer care.
This has been developed by the pre-registration workstream within the ACCEND programme and led by Julie Armagum. The Foundations of Cancer Care has been written and developed for pre-registration students. However, this will be a useful and interesting resource for the supportive and assistive level of practice. The course will help you gain greater insight into cancer care, what cancer is, how it develops, the impact on patients and families, communication, the role of research, and how to look after yourself and colleagues.
The Care Certificate has 15 modules, which you can do via e-learning and also evidence within your practice in the workplace. So you're working in the support of an assistive workforce and you wish to enhance your knowledge. Well, the Essentials of Cancer Care is the e-learning for you. The Essentials of Cancer Care includes e-learning in biology, cancer diagnosis, the treatments, and also the cancer pathways. The supportive workforce undertakes personalised care interventions for all the patients and carers that they see. Our partners in Guy's Cancer Academy have developed this e-learning, and it undertakes how you would complete a personalised care assessment, care planning, signposting people to services, and also to support patients through their cancer diagnosis through key communication skills. The Principles of Cancer Care programme was developed in 2017 by Sharon Rowe, the Workforce and Transformational Lead in Cheshire and Merseyside Cancer Alliance. Over the last couple of years, there have been pilots to roll this out, and in February 2023, the first national programme was launched. This 4-day virtual learning programme of work consists of peer-to-peer discussions, communication and psychological skills, understanding what cancer is, and also looking at personalised care interventions. You'll be able to register through the Cancer Academy and record your learning in an e-portfolio. Please click on the link that will take you directly to the Cancer Academy. So you wish to progress in your career? Evidence work-based learning is for you. This is an academic qualification where you complete a reflective study for your place at work. This will give you the evidence and the qualification to be a senior support worker. So welcome to the ACCEND Hub, and you wish to learn in your own time. But we have pulled together e-learning resources from many partners: Macmillan, Personalised Care Institute, e-learning for health, other long-term conditions, and other e-learning courses, all aligned to the career framework. You can also click on a tab which supports you to support others, looking at the cancer care map, or signposting patients and carers to other services in your local community.
Lovely, thank you. That's a great video, and thank you, John, for passing over to me on this webinar. I'm really happy to be here to talk to you about the work that's been happening in the pre-registration workstream to support pre-registration students. So my name is Julie Armaghan. I'm a Macmillan Senior Lecturer at the University of West of England in Bristol, and in this context I'm a steering group member of the ACCEND programme and also the lead for the pre-registration workstream. Now, as a workstream, we were really keen to support students with their knowledge and understanding of cancer, and recognising that when we released the framework that we needed to support both students, universities and practice with some resources to enable them to signpost for their students. So we've created this series of e-learning modules for them based on the Cancer Nursing Careers e-learning that was already available. We took that e-learning and the workstream has developed, rewritten and revised that those e-learning, especially for pre-registration students. So the workstream consists of members from cancer education, with a cancer education background, from clinical practice and research. And like others, I'd like to do a huge thank you to all the workstream members who've worked so tirelessly to make these resources the fantastic resource that they are for students. They've been through a really rigorous process of peer review, which I'd like to share with you all today. So when you're recommending them to your students, you can have confidence in their development. First of all, we revised and developed all the content to ensure that they were relevant, up to date and appropriate for pre-registration students. They then went through a process of peer review, and importantly, it was pre-registration students that looked at these e-learning modules. They undertook the modules, gave us feedback. Fortunately, almost all of those that participated in the peer review, so over 95%, thought that they were good or very good, and that they could increase their knowledge and understanding of cancer care, and also their confidence to care for people affected by cancer. They also felt that they were pitched at the right level for pre-registration students. There were some comments that they made about improvements that they thought could be included in the e-learning, and as a team we were really keen to embrace all of those comments, and we re-edited the Foundations of Cancer Care to ensure that all of their recommendations were taken into consideration. We also thought it was really important for people in practice to review the modules, so they were peer reviewed by healthcare professionals in practice, and because the Workstream members were predominantly nurses, we felt it was really important that those healthcare professionals were allied health professionals, just to make sure that they were appropriately balanced for all pre-registration students. So those healthcare professionals in practice peer reviewed the modules, and again their feedback was taken into consideration. And then finally there was a process of quality assurance both within NHS England and eLearning for Health to make sure that that everybody was very happy and content with the modules. So we're really pleased and proud to be able to support pre-registration students with these modules and share them with you all as a cancer community and wider. Can I have the next slide, please? Thank you. So just to give you a little bit of an insight into what the modules look like, the video that's going to be playing will just show you the what it's like for a learner when they go into one of the modules. This is the context of cancer. So throughout the modules, there's written and interactive content. There's links to websites, podcasts, documentaries, charities, other e-learning, and there's also workplace activities. So we know that students will be looking after people affected by cancer, but they may not experience a cancer-specific placement. So we have created some workplace activities to help them to consider how they could meet those capabilities in practice, even in a non-specialist area. We've also given them some reflective activities so they can think about their practice and their own learning and development as they go through. We were also very mindful that students may be taking this at any point during their pre-registration programme, and also not necessarily with the safety that you would have if you were in a classroom with people. So we've ensured that there's lots of opportunities for breaks, opportunities for reflection and for support for students. There's also self-assessment opportunities, so students can test their learning, and they have opportunities to retake those should they need. There's also lots of references to up-to-date literature and further resources to point students to. So hopefully these are going to be a huge resource and help for both pre-registration students and education providers, and also those in practice seeking to support their students with their learning. We recognise that there's lots of advantages to e-learning, the accessibility. It's people can go back to it at a later time when it's relevant and pertinent to them. But we also recognise that there's more resources that we need for pre-registration students and the rest of the workforce, as my colleagues have mentioned during this webinar. So we'll be working towards developing those in the future. And our first aim for that is to help education providers with some pre-registration guidelines about how they can increase cancer care into their pre-registration curricula. If anybody would like to be involved in that, please let the ACCEND programme know, because we're very happy to involve as many people as possible. The joy of this programme is collaboration, so we're really happy to have as many people involved as possible. Next slide, please. We're also very keen to evaluate the e-learning. We want it to be as useful as possible for people. So if you are a pre-registration student yourself, or you're guiding students to the e-learning, we'd be really grateful if people could complete the evaluations so that we can ensure that the learning is meeting the needs of the pre-registration students. Thank you very much. If anyone's got any further questions about that, please add them to the Q&A. The whole team are really happy to take any questions. So on that note, I'll hand over to June. Thank you very much.
Thank you very much, Julie and the rest of the team. And we're now at the question and answer session. My name's June Davis. I'm lead allied health professional and nursing advisor within Macmillan Cancer Support, and ACCEND co-programme lead with Libby. So we're now just going to go to question and answers, and you will have seen in the live webinar function there is both chat and Q&A. If you wish to add, and we have quite a few, so thank you already to colleagues for adding some questions. We have some already, but if you have others, this is your opportunity to ask. For those that we perhaps can't answer, or that that more detail, we don't have time. We will look to answer as many as possible, and as James, I know in the background, has been helping us with, we will share the recording and associated content in this webinar with colleagues who have participated. So I'm just going to take us through, and I will call on colleagues as we go through the different questions. So I'm just going to take us to the first one, which is about digitalisation of the framework. So is there a time frame on this development? And then the second bit of that is there a way to access the capabilities by level of practice so it can be broken down? There is a plan to digitalise the framework, and that will be during likely the next financial year, so from 2024 onwards. Vanessa, can I just bring you in just in terms of the levels of practice? Perhaps that might be something to do with the how-to guides.
Hi, yes, thanks, June. And just going back to the question, in terms of the levels of practice, just remind me of the question again. Sorry, I have to say I was responding to a question in the chat at the time, so just remind me. You caught me out there.
No, so that's not a problem. So it was to understand that the capabilities are going to be digitalised.
Oh yeah, digitalised, yes.
That was that bit. And then the second bit was about is there a way to access the capabilities by level of practice so it can be broken down?
Sorry, yeah, I was responding to a question, apologies. So yes, there is a plan to digitise the capabilities and to create an e-portfolio, and we are working with the team at NHS Workforce Training and Education on that. It has been a request, and we're looking forward to working on that with them. The timeline may be into 24-25 at this point, but it is something that we are working on and would like to achieve. In terms of the different levels of the capabilities in practice, we have separated them out in the implementation guides that you refer to. They're available on the framework website, and what we've done is separate them out into the supportive assistive levels, the pre-registration levels, and the registration to consultant levels, so that there is that flexibility for those at registration and beyond to look across and see where the level of capability is required for their particular role in practice. As I think I said in the presentation, although the colour coded for each level of practice, we do recognise that there will be flexibility that's needed for individual roles and within particular services. So the registration to consultant, you can see those 4 levels together and select out the appropriate level for your area of practice and role requirements, and similarly for the supportive and the pre-registration. The implementation guide for the pre-registration also includes an audit tool for education providers to look across at both pre-registration and continuing professional development curricula to see where they can incorporate the capabilities into either practice portfolios or module assessments, for example. Does that answer the query?
Thank you very much, Vanessa. I think that's really helpful and comprehensive. Thank you very much. Just to continue going through the questions, we've got a real mixture, so I'm just trying to sort of theme some of them together. There's quite a few about funding and costs, which is they're important, so we'll try and sort of lump it together if that's acceptable to colleagues on the webinar. So in terms of funding for the education and training and development that was shared in terms of the plans for 23-24. Funding for the programme is via NHS England only, so is for England only. However, with the engagement that we have across the programme from the 4 UK nations, the ACCEND Cancer Hub, as you have had demonstrated today, is available across the UK. The other thing to say about that is, I think there was a question about the cost to access information and courses on the hub. Anything that's content that's on the ACCEND Cancer Hub is free to people to access. So hopefully that helps answer that. Clearly, through the hub, we are signposting to other resources and other programs as well, and we will continue to do that through the other levels of practice. But the actual content that's available on the ACCEND Cancer Hub is free to access. So hopefully that helps clarify. I'm just going to come to another one, which is about level of practice, if I may. I think, Vanessa, this might be one for you. I'll just read it out so we know what we're talking about. So a colleague here has said they've been looking at developing a framework for enhanced practice, but it is very difficult to define and place this in an operational department and differentiate this from advanced practice. Really important point. What are your thoughts on this? I think this is a really key one, and I think this is why the capabilities in practice really help, because we have the 7 levels of practice. Vanessa, can I ask you to come in, if I may?
Yeah, I saw this question, and so one of the things I was doing as well was to go back to the framework and to look at the guidance within that, and I think there are hopefully some things in there that can help the person who asked the question. I think the place to start in terms of differentiating from advanced practice is we work really closely with the Centre for Advancing Practice and other nations around their frameworks for advancing practice, and the HEE Centre for Advancing Practice wanted us to emphasise within the framework that those working in roles where they were defined as advanced practitioners or considered to be working at advanced practice levels had to be able to demonstrate the generic capabilities in the HEE's framework for advanced practice across all the 4 pillars of practice, so that they had to meet the generic capabilities for that framework alongside the capabilities that are identified in the ACCEND framework, selecting out the appropriate ones at advanced level for specific roles. So the advanced level is well defined in that sense, meeting both the generic HEE capabilities for advanced practice across all 4 pillars, plus any cancer specific ones from the ACCEND framework. But from the other end of the spectrum then, in identifying enhanced capabilities for someone within the specialist cancer workforce, it will be looking at the core knowledge and capabilities that are identified from the fundamentals module or learning outcomes. So has somebody got that baseline knowledge for caring for somebody with cancer, and those generic capabilities identified for registration level, plus those specialist capabilities that they might need for area specific roles, for example within a specific cancer site or a particular type of care that they might be involved in for caring for someone with cancer, such as chemotherapy or radiotherapy, for example. So it's having that area specific, role specific knowledge for the enhanced level, but not necessarily across all 4 pillars of practice that are required for the advanced practice role as well. So does that help?
Really comprehensive. Thank you so much, Vanessa. Really good. I'll give you a short breather, if I may. And there's a few around pre-registration. Julie, if I could ask you. So the first is, I think, a yes, no. So I think I can do this one. So the pre-registration 9 modules, Foundations of Cancer Care, are live now, so you can access those. There was also a question about, could those new to cancer access those? Absolutely. Who perhaps they are, yes, designed for pre-registration nurses and HP students, but actually available to others. And as John had said, also potentially some of the content is of use and of interest and importance to the supportive and assistive workforce as well. There was a question, Julie, around how the pre-registration content links to curriculum. And I just wonder if you might want to just answer that, if that's possible.
Of course. Could you just let me know the question? I think if it's about, is it linking to how it links with our pre-registration curricula?
Yes,
So,
yes,
fabulous.
yes. Generally,
so,
yes.
Yes, fabulous. So we are working with you. It's really important from a university perspective to help all universities understand how this work can align with the already packed curricula that they have for their pre-registration programmes. So that's our main piece of work next, is really working with universities. I saw there was another question as well about how we're working with universities, and I'll come to that in a moment. So it's really working with universities to help give guidance and recommendations about how this curriculum can be incorporated into their curricula. It's not for us as an ACCEND programme to prescribe how individual providers do that, but we can certainly give recommendations and give case studies about how certain organisations are doing it. So we'll be working in collaboration with them and really giving them recommendations and examples, practical examples of how the work can be incorporated into their pre-registration curricula. I saw there was a question about how we're working with universities, so if I could take that, Jean, it would be great. It's really key that we work with both clinical practice, with practice assessors in practice supporting pre-registration students, but also with our university colleagues across the UK, and we have been committed to that from the beginning of ACCEND. So within our work stream, we have made sure that we've got representation from universities from across the UK. We've already got a good diverse work stream going with working through these programmes, and very crucially, our next steps, we've worked with the Council of Deans, and for anybody on the call who's not familiar with the Council of Deans, it's an overarching body that works with over 100 universities within the UK, and we've been discussing ACCEND with them for some time. They're really keen to support it. They've supported and endorsed the framework back in January, and they're also very happy to and keen to support and work with us to disseminate this work through the university channels. So in answer to your question, it's absolutely we're engaging with universities. We recognise that it's really key to support universities, to work with universities and our clinical partners to really enable that cancer education to be included and increased within our pre-registered curricula. I hope that answered your question. If not, please come back to me. Thank you.
Brilliant, Julie. Really comprehensive. Thank you very much. Libby, I wonder if I can come to you. There's 2 separate questions, slightly different things, but hopefully these will help clarify. One is, do you see ACCEND replacing existing education training and development? That's question 1. If I just say both, and then that might help. The other one is about the timescales for the workforce baseline exercise and how that will be achieved.
No problem at all, Jean. So the first question is a bit like being in an interview, isn't it? First of all, I absolutely do not see ACCEND replacing existing training and development. I think ultimately what we hope to do with a lot of the hub content, particularly, is signpost to where everything exists, and we're starting to look at how we might do that when we come to map out the RETA part, the registered enhanced towards advanced site, which we name as RETA, and also then the leadership advanced and consultant hub areas. So actually identifying where everything is, where the training and education is, and being able to provide really good links, and also links to papers and research and all sorts of other hopefully really useful information and resources that we want to find out what is useful and useful information clearly. But once we found that and gather that and put that in one place, as we've heard from our professionals, finding this information can be really hard, and you have to navigate the system quite hard to find that information. So I don't think it is. I mean, obviously we are procuring for the qualification in specialty in cancer and in a clinical leadership and professional development module that we are hoping to go out to procure this year. I mean, clearly those are going to be qualification in specialties which will be linked to the learning outcomes and to the competence capabilities in practice, which Vanessa has already spoken about and are available in the ACCEND framework. So there will be some additional, what we hope will be really useful learning and training products that will be coming out through the ACCEND programme to support the system. But obviously a lot of it will be about signposting and trying to help people find where things are for them, both for capability building, education and training, and career pathway information. I think somebody asked about the baseline data exercise. So this is something that we've wanted to do really from the outset, and we've needed to take that through approval processes within NHS England and the Department of Health, and have had approval from that recently. And this is really to do quite a comprehensive bit of baselining. So it's about finding out mainly two things, I think. It's finding out who our cancer workforce is currently. I mean, clearly we can go to places like ESR and surveys and lots of information, and we will do as much as we can to satisfy the need to know stuff about the workforce through those means, but we know that they aren't necessarily completely thorough in the information that they can provide. So what we hope to do is do some baselining of that workforce to know and understand who's out there, how many people are in advanced roles in cancer, how many consultants we have, and also, though, really importantly, what's their education and training needs as well? Where are the gaps? What do they really want to focus on? What was also needed to enable them to be aspirant in their career development as well? So that's a really, really important thing, and I think it's going to be a really important output for the cancer workforce to know and understand and learn more. And we hope that will assist lots of other providers as well in understanding and being able to succession plan for their workforce as well. So we hope that would be really useful. And I think I could quite happy to answer about, I think somebody's also asked about when the Innovation Fund might be available as well, Jean, in the chat. I think I'm right in thinking that. So we're working currently on working out how we're going to make that available, and how we're, as ever, going to be able to transfer the money and do that in a really equitable way and make everybody aware of this funding, and also sort of draw up a clear sort of criteria. It will be focused, as Vanessa said, on the implementation of the framework. We're going to be asking for providers to be able to think of innovative ways to develop implementation of the framework within workplace settings, and really going to be looking to support that, develop a community of practice. And to be honest, I have to be honest, there'll be a lot of benefits to the programmes as well, learning about those innovations and seeing whether there's anything that then we could scale up, potentially roll out further. So I hope that helps, Jean.
Really great. Thank you very much, Libby. I think we have time for one more question, and I'm just going to shoehorn it in if I may. It is about those colleagues that work in research, Vanessa, and basically, is ACCEND for them? I thought you might like to answer that.
Absolutely, thank you. The ACCEND framework at the moment predominantly focuses on a clinical career pathway. However, there will be some of the capabilities and the foundation knowledge around cancer that is appropriate for those with a specific focus around research and research roles in cancer. In addition to that, I am working with a group of colleagues, clinical cancer clinical nurses, clinical research nurses, to look at the framework and to identify those specific capabilities for those in those roles, and to identify any potential gaps where there might need to be some additional capabilities for that particular career pathway. So the answer is yes, it's relevant. You can pull out the relevant capabilities for research roles at the moment, but we will also be working on a specific cancer research role route, which we will include in the next version of the framework, alongside a clinical educator route within cancer as well. So we'll be looking at any additional particular capabilities for those routes for the next version of the framework.
Thank you, Vanessa, really helpful. We're going to need to conclude in terms of questions, just in the interest of everybody's time. So 2 things to mention. We have a slide here just about webinar 2, which is on the 10th of July, particularly focused, and we're really delighted to have colleagues from the Centre for Advancing Practice with us, who we have been working on around the advanced practice piece. And we have basically a question and answer session with colleagues from the Centre for Advancing Practice, which hopefully colleagues will register if they wish via the QR code. And I think, James, you've kindly put the link in the chat as well, so that's really helpful. And the second thing was just evaluation from this webinar. Any thoughts? Gratefully received. Always important that we receive feedback from yourselves. Thank you to all of you for joining us and taking time out of what I know are extremely busy schedules to be with us. And also thank you to the wide ACCEND programme team, who've done a brilliant job behind the scenes and also in front of the camera, sharing where we're at with the programme. And I'm sure we will all, some of us or several of us, be in touch in due course. Thank you all and have a good rest of the day. Thank you.